Hi everyone, my name is Muhammad Al-Kahtani and this is my partner.
خالد الشمري.
Actually, we are going to talk about the blood pressure and teach you in this video how to take blood pressure. As everyone know that the blood pressure is important for everyone. So I will ask Khalid why it's important.
To indicate some diseases such as hypertension and hypotension.
So what does hypertension mean?
Hypertension means high blood pressure.
What about the hypotension?
Hypotension means low blood pressure.
In fact, there are two kinds of blood pressure measurement, which are the automatical way and the manual way. So, what do you think? Which one is the accurate one?
Actually, the manual way is like more accurate and more effective than automatic way.
Okay, so we're gonna use the manual way to measure the blood pressure. So, can we go to take the blood pressure and teach the student?
Student paramedics?
Yep.
Yes, let's go.
Let's go. In fact, me and him decide that Khalid will be patient for you to make this video easy to understand. As we said before, the manual way need two equipments, which are the cuff and this stethoscope. So Khalid gonna explain the cuff for you.
Okay. This is a cuff. We put it in the arm, and this little gauge to indicate the number, and this one to inflate and deflate the cuff.
And this stethoscope, Khalid gonna explain that as well.
The scope, it have be toward to you, and it has we're gonna make sure it's open by switch it on or switch it off, and make a test by doing this, and make sure you wear it and you listen the thumb.
Okay. I'm wearing gloves because it's important to wear gloves and goggles. And when you need the gown and the face mask, just wear it.
For safety reason.
Yep. As we said before, Khalid gonna be patient for you. So it's important to tell the patient what we are going to do. So
Yes.
Khalid, we're gonna take the blood pressure from you.
Yes,
Is that
that's
right?
okay. Yeah, take your time.
Now we just open this cuff and we're gonna put it on the Khalid arm. Before you put it, you have to be sure the patient's arm is relaxed and outwards and his palm is facing up. And we have to choose the best size for the patient. Do you know why?
Because there's a different size for obese people and children people. You have to choose the appropriate one.
Yep. So here we go. We're gonna place this cuff on his arm. And there is arterial arrow, and we have to be sure to put this arrow indicate the brachial artery. And as you see here, Khalid is not wearing any heavy clothes. So if the patient are wearing heavy clothes, let them to remove it, or you can remove it. Fasten the cuff nicely tight. Just hold this for me.
Okay.
And this little gauge, we have to put it above the cuff, or you can ask the patient to hold it, because we need to find the reading clearly. So as everyone know that and saw that, we placed everything in the good position. So this is the cuff, and this is the gauge, and this is the things for the inflate and deflate. So there are two method ways to take the blood pressure measurement. So the first way,
The first method is palpation method, and the second method is escalation method.
so the palpation method is help us to find the systolic number. What is the systolic number?
Actually, each blood pressure measurement has a different has a two number, the high number and the low number. The high number is called systolic, and the low number is diastolic. Also, I will let you know the systolic number is means heart contraction, and the diastolic number means the heart relaxation.
Yep, you're right. And as we said, the palpation method is from the radial pulse, which is here. So how can I find the radial pulse?
We are taking the pulse from the, as Muhammad said, from the radial pulse. It's proximal to the thumb. Just we place a few fingers until we feel the pulse.
Yep. Now I'm going to take the systolic number, as we explained before, from the radial pulse. So we're gonna inflate this until we cannot feel the pulse from the radial pulse, and deflate it slowly until we feel the pulse again. So here the few fingers here to feel the pulse. I feel the pulse now, and we have to be sure the locker is in the right position to inflate the cuff. So now we are inflating the cuff until we cannot feel any pulse from the radial pulse. Now I didn't feel any pulse. Deflate slowly until we can feel the pulse again. I feel it here, which is 115. So this is the systolic number. Now we're gonna take the blood pressure from the brachial pulse.
Which is escalation method.
Yep. So we have to find two numbers, the systolic number and the diastolic number. So we need the stethoscope in this method. So we're gonna put this one on the brachial pulse. So we have to find the brachial pulse first. So as we found the systolic number from the radial pulse was 115. So we need to inflate the cuff until like around 160 and deflate the cuff slowly until we hear the first beat. So the first beat will be the
Systolic number.
feel it slowly. I hear it at 118. Now we're gonna deflate this one until we cannot hear anything. We didn't hear anything. I didn't hear anything at 78. So the blood pressure measurement is 118 out of 78.